Okay, so now that we've shown you how to actually do a hatch residue breakout, analyze the unhatched eggs from each tray, let's look at talk about what we can do with some of the data and how we can use that data to troubleshoot hatch problems. First of all, we want to look at the type of spreadsheet or breakout sheet that we use, and needs to make sure we cover some of the main topics of separating fertile versus infertile eggs. Our dead embryos need to be broken into at least first, second, third week mortality. I break it up into 5 different stages. But they still fall in those 3 categories. We need to separate cold chicks, transfer cracks, contamination, misplaced eggs, a number of different things. The more data you can gather here, the better when we're really trying to analyze look at some potential losses in hatchability. One thing to remember, this is a biological system. Therefore, we have to expect mortality. Losses are unavoidable. Fertility, 1 to 2% of our eggs will be infertile, and this is dependent on the age of the breeders, the strain of breeders, health status, things such as that. Embryo mortality, 4 to 5% total embryo loss will be incurred. Again, depending on breed strain, age of flock, fertility, egg age, storage conditions, incubation conditions, certainly. But in the best case scenario, we're still going to have 4 to 5% total embryo loss. And so that's kind of our normal that we want to look for. When do these losses occur? Early dead embryo losses that first week, we will incur about 2 to 2.5% embryo loss under best case scenario. Again, this is biological. Some cell differentiations occurring, the embryo is trying to develop. If things don't proceed properly at that point in time, we will have some embryo losses regardless of what we do in our incubators or our egg handling. Our mid-dead, less than 0.5%. Often we talk about this is if we see elevated levels here, it's a nutrition problem. We rarely see this. If the nutrition problem is severe enough, birds will typically stop laying as well. I don't see this, haven't seen this much at all in my career as really being an issue. We should stay under that 0.5%. Late dead, that last week, again, we have about 2 to 2.5% of normal embryo loss. This is when the embryos are switching to pulmonary respiration. When they PIP into that air cell, get ready to hatch, they need to start breathing through the pulmonary respiratory system. If that doesn't occur, we have some embryo losses. So about 4 to 5% broken off, 2 to 2.5% in that first week, and then also in that third week, less than 0.5% in that middle, as we can see right here. When we see levels elevated above this 2 to 2.5% in that first week, we look at egg handling. Everything from the time the egg was laid to the time it gets in the incubator. Transportation trucks, on-farm egg storage, frequency of handling, temperature abuse during that time period, how long they're stored. All these factors from the time the egg is laid until it gets into the incubator is considered egg handling. That middle period, middle week, nutrition problems can cause higher than 0.5% embryo mortality. Again, we don't see that much. And then we look at that last week, about 2 to 2.5% is normal embryo loss. When we see this number elevated, that's when we start looking at our incubation, either incubators or hatchers. So that kind of helps us focus on the area to look. Does it make a difference between single stage and multi-stage? Yes, it does. Even though our early dead embryo loss is due to egg handling prior to the incubator, the single stage machines are better equipped to start that embryo developing into the chick that we're looking for. Multi-stage is because we're incubating for the average, we will tend to have a little bit higher elevated early dead if we have some abuse or some problems in our egg handling situation. So again, they follow the same pattern though, that 2.5% on that first and last week. The embryo breakout sheet I use allows me to record as much data as possible without getting too cumbersome. And I think that's the important part, is really getting enough data that we will actually gather and not be overwhelmed by it. That first, any embryo losses in that first week, remember, can be attributed to egg handling issues. In that middle week, we can attribute that to potential nutrition problems and elevated embryo losses in that last week. is when we start looking at our incubation, our incubators or our hatchers. Typically is where we'll see the root causes of late embryo mortality. And there's a couple things going on here biologically, cell differentiation and just hatch problems and conversion to pulmonary respiration in that last week. So need to remember those factors. So if we look at the breakout sheet, and this is like after I've gathered data from 8 flocks, sort by age, fertility, look at all the data that we gathered. And there's a lot of numbers here, but these are the most important, and then all these is that they contribute as well, especially if we see issues anywhere here. So let's look at some of that a little bit closer. In this particular data set, we can look at early embryo mortality was a little higher than it should have been in all cases. Not so bad in the younger prime flocks as it was in the older ones, but we did have some early embryo mortality issues. Middle is about where it should be. If I see numbers like this, I often start to question the breakout procedure. Some of those are often really middle or early or late embryo mortalities, but still this is a low number. Late embryo loss, again, too high. Even some of our better flocks up front here, we're still up at 5%, 4.5% to 5%. So we had too high embryo loss. Overall, we just had significantly too high total embryo loss. Nearly 15% for the whole flock of the 8 flocks that we evaluated this day. High all across the board. So this would kind of start telling me there's 2 areas to look. We definitely can look at some egg handling issues. We definitely can look at some incubation issues because we've got high early and high late mortality. We can then also look at some of our other data. If we start seeing a lot of live PIPs that are unhatched, we think we might have some lower temperatures. We didn't give the chicks enough time to fully develop to hatch out. A lot of dead pips might tell us another thing. Maybe they were moving too fast, too dry, too wet. We can see some of both of these. And so we can look at all the other factors in here. We typically want these to all be around 0.5%, certainly not over 1%, but around 0.5% is what we would consider normal with that. And a lot of this data is best utilized comparing to our early, middle, and late embryo mortality. Looking at some good flocks here, what does a good normal flock or normal hatch residue look like? Again, this is some real data here. Total early embryo loss from the eggs collected or evaluated from the bottom, middle, and top of that machine, about 2.4% early mortality. Certainly within range of what we're looking for. 0.4% middle, it's what we're looking for. 2.18 late percent for a total of about 5% total embryo loss. And that's ideal. That's a biological system. This hatchery then is doing about as good as it can do with the eggs that it's given. Fertility is good. Always, to get good hatch, you've got to have good fertility. That stands to reason. That makes perfect sense. But we cannot hatch infertile eggs, so we'll always see a high fertility level when we see these other values where they should be as well. Looking at a flock that experienced some high early dead, 16, almost 17% early embryo mortality, regardless of top, middle, or bottom in that machine. From 15.5 to 19% early embryo mortality. Fertility is also not where we would like it. That can contribute to some of this early embryo mortality. Our late losses, a little over 4%. That is high. In this scenario, first place I'm going to look for is what can we do with this early dead embryo mortality. Some egg handling issues can carry over to late mortality. This is our biggest issue by far here, is early embryo mortality. We can look at our egg handling issue from the hen all the way to the hatchery. Track temperatures and everything. What about late dead? Doesn't look too bad here. Our early embryo mortality, a little bit high, about 1.5% high. But look at our late, we're at almost 8% embryo mortality late, 10% in one of these flocks, for a total embryo loss from this flock of over 12%, which is 7-8% too high. Where would we look in this flock? Primarily, I'm going to look at incubation because this is our number that's the highest. We may have some egg handling issues as well. First place I'm looking is in the hatchery. Look at our incubation profiles, our temperatures, our hatcher profiles, hatcher temperatures, and ventilation, and everything within those machines that can cause these numbers to be elevated. Another thing we can do with the data then is look at the position in the machines. Taking this is the same data, and let's take all the flocks we looked at this day, 8 flocks, break them up, those that were all positioned on the bottom of the rack, middle, and the top. This happens to be a multi-stage hatchery. If you've got single stage, you can do the same thing. You can actually even further break this up. Buggies, top, middle, and bottom of a buggy next to the ECU, next to the wall. So we can really look at, especially if we suspect some problems with our machines and our in the hatchery itself. So taking this data and looking at the machine position effect, we can see here that all those eggs, regardless of the flock and age, we had almost 3% less late embryo mortality when the eggs were in the middle of that buggy. 2% less total embryo loss. That's a significant number right there. What can this tell us? Okay, we've got a position in that incubator that is not, we have a situation in the incubator that's not uniform. Ventilation is likely an issue here. Air is moving too quick through parts of the buggies, too slow through parts of the buggies. Either way, we're getting some ununiform conditions in that incubator. Sometimes we would see that here in our live pips or dead pips. We may see a lot of live pips, maybe 2% live pips when we have high late embryo mortality. That would tell us in that position, flock, or in this case, in that position in the incubator, we might have a cool cell, a cool spot where the embryos are not growing, developing as quick as they should, or we could have vice versa as well. So you can take the same data and not only look at it as how is each flock doing, how are we doing collectively as a hatchery, but also how are our machines doing by position in that machine. Whether it's a multi-stage or single-stage incubator, we can do it in both and really add to what we learn about our hatch residue breakout and try and improve upon our performance. So hope this helps you all, and like with anything, if you have any more questions, then be sure to contact us at Jamesway. Thank you.